That's it.
Hello, doctor.
Hello.
Hi.
Can we start or wait?
I think start. I don't know.
Yeah, it's already to 5.
Okay, let's start. So today we will talk about investigations, how these investigations and researches are important for us. Because of we know the diagnosing process is crucial and sometimes we need additional methods to reinsure diagnose, not to misdiagnose and not to lead other problems. For this reason, we are using additionally some kind of um, extra, let's say like this way, investigation methods. So as we can see here, the first research or investigation that I want to introduce is urinalysis. This kind of test gives us information about proteinuria or bilirubin level, or for example glycosuria, ketonuria. So as you can see on this slide, according these conditions is measured. For example, if urinal after checking analyze of urinalysis, and if it reveals their glycosuria, it indicates that patient is having diabetes mellitus. Or for example, if patient in patient condition will be revealed bilirubin, this indicates some kind of hepatobiliary disorders. Or hematuria also can lead some kind of, it can be lead due to menstruation or indication renal urinary tract diseases. So as we can see, it gives us such kind of general condition information about patient's general condition. Now, just I want to pay your attention about the skin testing and why nowadays we are just referring and preferring more skin testing, and what kind of skin tests are we doing today. Um, I don't know, but what you heard till now, what do you think when we are sending patients to bring us allergic tests? What do you think? These allergic tests, which one is more reliable to do? Blood test or to do skin test? What do you think, girls? Can you
Maybe
say
blood.
about that?
It depends.
No, no, no. I'm asking, for example, you're a dentist, you're a future dentist. You want to check patients' allergic reactions.
Mm-hmm.
Allergic reaction towards some kind of solution. What do you think?
Blood.
Which allergic?
When I did the allergy test,
Yeah.
they put something to my skin in order to check the reaction.
So that's why I'm asking. Blood
So
test
the
when we
skin,
are
the skin
checking
from it.
immunoglobulin. Wait, Alexa, when I'm talking, when we are checking immunoglobulin, or depends on which type of blood test are we choosing. In some cases, allergologists are choosing and just measuring immunoglobulin level, or in some cases, leukocytes, okay, in blood. Which ones is blood test is more reliable, or for example, skin test that you mentioned before?
I would say skin.
Skin one. Marilyn, what do you think? Green, red. What is Sabrina?
I don't know.
So what do you think, girls?
Uh,
Alexa thinks that it's about skin test.
I think we need both.
Both. Actually, as allergologists are suggesting and say, the most reliable is skin test. But we should know exactly, for example, according pharmacological effect and just composition of test depends on how many times should we wait. But always they say that if it will be better if we will wait 24 hours or more than we should just observe after making this skin test, it's swelling, it's changing in color, or what's happening, okay? But I want to just mention here something about the skin and why it's more reliable, as we already know that because of our skin that from outside is covered with derma. Okay, we know that these substances or solution through the intact skin is poorly absorbed, but we should say that it's more reliable condition, so it's more reliable so investigation. But as soon as we are starting doing some kind of skin test, according that on the other hand, we should have, and we should resuscitation equipment. We should have such equipment to cope directly this allergic reaction. If this allergic reaction will reveal. So what kind of resuscitation equipment are we talking about? So of course, and other types of, but also in this case, the most important thing is what we are using adrenaline, or the second name we can refer is epinephrine. What's the concentration of what kind of what concentration of epinephrine are we using? 1 in 1,000. Is it clear? Directly when we are making this one, there nearby to us, we should have such kind of equipment. Is it clear, girls? Now let me introduce you patch test. What is such kind of patch test? Actually, patch tests we are using. I'm having video here, and I'll show you it also. During patches, mostly it's done on the area of forearm, and also mostly we are detecting problem if patient is having any kind of contact allergy. Okay, so now I'll show you how this patch test is done. But one thing even that I want to mention, that's patch test when we are doing this result, we should wait till 48 or 72 hours approximately to be sure that for example, some kind of solution have allergic reaction or not. Wait a second, I'll try to widen it. And can you see, girls?
Yes.
Yes.
Yes. But please, can you raise the voice?
What? Sorry?
Can you raise the voice, please?
More than okay, but as I can see, it's maximum. No, it's
Okay,
maximum.
thank you. But doctor, we can't hear, okay? We can't hear at all.
You can't hear it at all?
No, 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 no.
No, we cannot.
Okay.
Maybe turn on the subs
What?
in order so. Maybe turn on the subs.
If I send you, for example, this video, or I don't know. Wait, so this
Yeah,
is
you can send it.
if it will be shared. Let me check it. Give me 1 second and I'll give it to you. Just wait. दोबारा copy yapsak. Wait, I'll send now in chat. The same video, let me check it. It should be copied from here, yeah? Why it's not? Okay. Hello, it's that, girls. You can find it. I don't know, you can see it now or maybe later, it will be better. But the technique, what is it, is what? Just we are placing it or forearm region and we are waiting for approximately 48 or 72 hours and we are just observing patient is having allergic reaction or not. The second allergic test that not allergic test, that second intradermal injection that I want to introduce is this one. So how just are we using or how are we doing? Of course, mostly it's done more forearm region. Before doing any kind of injection, of course, this forearm region should be cleaned, and this should be, for example, cleaned, yeah, with alcohol. And after that, we are using a needle, and with such kind of degree 10, such kind of percent degree, we are penetrating needle in dermal region, and we are splitting solution. But while penetrating and injecting needle into dermal tissue, this on the dermis, so we have to check that our needles bevel should be for just looking upward. Is it clear what is bevel of needle, girls?
Yes, yes, doctor.
So this bevel should be upwarded, this pointed upward. So I want to say this one, and needle of gauge should be 26 up to 27. For this reason, precise measurement of smaller quantities also is difficult and requires syringe with especially well-fitting plungers and micrometer screwed gauge also. Now let me show you. I don't know, I will try even in this case if it's working. Wait a second. If it's working. If you know it's working, but if you can hear the voice, I mean that. Or I'll send it also. Let me share it. Girls, can you hear it?
We're back with another session of how to.
Can you hear
Yes,
it?
doctor. We can, we can.
Yes.
Yeah.
Yes, yes, we
With
can.
SJBC. This is a clinical medical assisting instructor, Mrs. Torres, and these are two of her students, Jessica and Maria. I pass out with needles, so instead of being helpful, I'm going to let Mrs. Torres and her students show you injections.
So today the first injection we're going to be giving is an intradermal test, an ID.
So the first thing I'm gonna do is clean the area. I'm gonna pull the skin tight. I'm gonna insert the needle at a 10-degree angle. I'm gonna slowly push in and administer the medication.
During this time, girls, as I already mentioned, this bevel of this needle should be upward looking. Okay, should be forwarded upward. So in this case, you should pay attention about that. And look, you are checking how this such kind of bubble or just a wheel shape lesion is creating above the skin. Okay, this such kind of projections as projection.
And it's
Look,
gonna become a wheel.
this indicate that this solution is splitting in intradermal region.
When she's administered her full amount of medication, she'll slowly take the needle out, put the safety on, and dispose of her needle.
Uh, so just wait. Now we'll share presentation again and continue. So this was about the intradermal injection, and now we're about the prick test. Girls, we are having prick test and modified prick test. Prick test, to be honest, we dentists we can do, but of course it's not reasonable. Why? Because of this prick test, during just when if we want to detect allergic reaction, even such kind of anaphylactic shock or some kind of allergic reaction can be revealed. So that's why it's not too much reasonable to do, but it's really simple procedure that we can do. So how are just we making this one? With the help of the sharp instrument, we are making incisions on forearm region, and we are splitting that solution that we want, for example, to inject. But always it's recommended to make several injections, several incisions on forearm region. One will be for that anesthetic, for example, solution that we want to check, but one will be for histamine, one will be for distilled water. Why? Because of we should compare what kind of reaction patient organism is having toward, for example, anesthetic solution, toward distilled water, toward, for example, histamine. In this case, just only for the compare to compare that's action, their action, okay? Just only for this reason. Now about the prick test, I'll show it. How is it working? I don't know, but I think even it won't work. I think so. Wait a second. Is it clear, voice girls? Voice is clear?
No, doctor, we can't hear.
We cannot.
Wait a second, okay. I saw that.
Today I will be talking about skin prick tests and allergy testing. A skin prick test is
Now, girls, I think it's clear, yeah?
Yes.
an accurate and reliable allergy test that can be used to diagnose food and inhalant allergies. It is a simple and quick test that can generate results in 20 minutes. A skin prick test is usually performed on the inner forearm or upper back. After cleaning and marking the area, tiny lancets that barely penetrate the skin will be used to introduce minute amounts of the allergens into the skin. There will be no bleeding, and most patients report only mild discomfort at the test area, which subsides quickly. Your skin may itch where the allergen is placed if you have sensitivity to the particular allergen. After 20 minutes, your skin will be observed for a specific skin reaction known as wheals. Wheals appear as red, raised, itchy bumps that may look like mosquito bites. The bump size will then be measured to confirm the allergic reaction. Oral antihistamine medication should be avoided for at least 5 days prior to the test, as it may affect the results. The skin prick test is a very safe test. The amount of allergens tested on the skin is very minimal. Hence, severe reaction to a skin prick test is extremely rare. However, a skin prick test may not be suitable for those who have had life-threatening allergic reactions to certain allergens because this test would be too risky for them. Those who have severe eczema or psoriasis, especially on areas that will be used for the skin prick test. Also those who are unable to stop oral antihistamine prior to the test. In these cases, an allergy blood test will be a more suitable alternative. Thank you for watching. I'm Dr. Elaine Low from Dr. Tan and Partners. For more information about skin prick tests and allergy testing, please visit our website at www.
Okay, so girls, the main point it was about the prick test that you are making incision and splitting their solution. Now, what can we say about the modification pre-test? In this case, girls, of course, first of all, that surface is cleaned, and after that, we are splitting
Just
solution.
increase
As
the
soon
PowerPoint.
as, Marilyn,
Yeah,
it
please.
takes much of our time, just when I'm switching on presentation, then switching on YouTube. So even I want to show you now some kind of
Okay.
videos. So I
Okay.
think it will be better if we will live like this way, okay? Because
Okay.
of that.
Okay.
So, what can we say about the modified prick test? In this case, of course, even this test we are doing on forearm region, and we are cleaning first of all, and here we are placing a drop of the test solution, and with the help of the needle, we are inserting in superficial region of this dermis and almost horizontally into the skin. We are lifting and raising this skin, a tiny tent of epidermis. So this means that this solution, small amount of solution, will be split inside, and we are just waiting for if allergic reaction will be revealed or not. But what kind of, I think it's this one, this test, this modified prick test is more sensitive than, for example, normal prick test. So for this reason, yeah, it will be better maybe if we will use prick test. But of course, this allergologist will get decision about that. Now, just wait a second. About modified prick test, no, but about scratch test, just I'm having a video about this one. Wait a second. Is it clear, girls, what's the difference between prick test and modified prick test?
It is more sensitive.
Not only more sensitive, what other case also, what I told you? Difference, procedure,
The inserting
the
it is
technique.
superficial.
This is different. Girls,
Yeah, when we are inserting the needle, it is like superficial.
this is modified, but what's happening during, okay, let's discuss first of all, prick test, normal prick test. How are we doing?
We do it on the forearm or on the back.
No, girls, you know what are we doing on forearm region? Of course, it should be
Yeah, we
clean.
put a tiny solution.
What are we doing, sorry?
We put solution on the forearm.
No, we are making, first of all, with the help of the sharp instrument, we are making incisions on forearm region, and we are splitting this solution, tested solution, okay, test solution. We are splitting on incisional region. Is it clear, Marilyn? But
Yes.
when we are talking about modified prick test, in this case, of course, on cleaned forearm region, I'm splitting first of all solution, and with the help of the needle, I'm just inserting needle in superficial region of dermis, and horizontally I'm trying to upward it, and this solution will enter inside. Is it clear?
Yes.
So that's why we say that the second one, modified prick test, is more sensitive. Now just I want to show you how, for example, wait a second, I'll copy it. And let's see the second video. Look, this is scratch test.
Hi, I'm Donna. I'm a medical assistant with the allergy group, and in this video we're going to show you how we do allergy scratch testing on adults. Allergy testing is done to determine what allergens, if any, that you're sensitive to. We can test you to a variety of things. Environmentals like animal dander, dust mites, and pollens. We can test for foods. We can test for local anesthetics like lidocaine, some antibiotics like penicillin, and stinging insects. In this video, we'll be showing you how we do allergy testing to foods and environmentals using the duotip method. Typically, if we're doing a full panel of tests, we use the back, but for demonstration purposes, we're going to use the arm. First, we cleanse the test site with alcohol. Then we wipe away any excess liquid with gauze. Then we label for the testing that we're going to do. In this case, we'll test for grass, cat, sagebrush. We also do a positive and a negative control for comparison. As you can see here, the 2O tips are submerged into extract containing the individual allergens. The tip is designed so that it holds onto a drop of the extract when we remove it from the testing wells. Then we use that tip to lightly scratch the skin cells, roughing up the top layer of cells and depositing a drop of extract at the test site. This allows the skin cells to interact with the individual allergens, and if there is a sensitivity, it will initiate an immune response. The test stays on for 15 to 20 minutes, and at the end of that time, we read the results. What we're looking for in an immune response is a raised hiver wheel in the center. It resembles a mosquito bite, and it will be surrounded by an area of redness or erythema, and it will itch. The wheel and the size of the surrounding area of redness is directly related to the degree of sensitivity to that particular allergen. Once all your test results are read and recorded, we cleanse the site with alcohol, and then we apply an anti-itch gel. At this point, the doctor will come back into your room, discuss your test results, and a treatment plan for your care.
So, girls, why are we checking and why are we looking for and observing during 24 hours? Because of some patients may just have direct reaction, but sometimes allergic reaction reveals later after maybe 24 hour, after 48 hour. So for this reason, always it's reasonable when a patient will do allergic test, after doing allergic test, maximum 1 day, just I mean 24 hours should be passed. Because of sometimes it depends on everything is individual. For some patients, these allergic reactions reveals later. So for this reason, we should wait. Patient may have immediate reaction. Maybe this allergic reaction can be revealed after several hours, but after maybe 24 or 48 hours. So for this reason, we should be very careful. What can we say and what can we talk about a biopsy? This is a topic that I want to say. What is biopsy? So this biopsy mostly helps us to to reassure, diagnose, for example, if there is cancer or melanoma or other kind of conditions and diseases. So this during the biopsy, we are removing small piece of tissue, but I'm emphasizing this is from the living body. And we are checking that part of the tissue under the microscope. So what kind of indications are we having for biopsy? In which cases, so are we just using and you just may taking biopsy? So when we are having pre-malignant condition, or if we are having some condition and the etiology is uncertain, or for example, if we want to confirm a clinical diagnosis, and so on and so on. Okay, but before listen taking any kind of just the doing biopsy procedure, we are having this precaution that should be taken into consideration. What are these? So first of all, the patient should intake anticoagulants, also corticosteroids and immunocompromised therapy should be done before making biopsy. Now, what can we say about the biopsy procedure and technique? First of all, of course, depends on just we are making this biopsy procedure only on one region or on several regions. Why, in which cases are we using from several regions? In which cases are we taking biopsies from several regions? If it's malignant condition, we are, of course, we should take from several regions to be sure, to be reassured. This biopsy Sometimes it requires local anesthesia, but sometimes it does not require local anesthesia. So, of course, the local anesthesia, mostly we are just making when, for example, when we want to take, for example, biopsy from with the help of the scalpel or tissue punch. Okay, now I'll show you how the scalpel and tissue punch looks like. Or for example, if we are making needle biopsy or such cases, of course, because of this procedure will be too much painful. Of course, it will be better if we will do everything under the anesthesia. Now let me show you how this punch and this lancet. I don't know, lancet. Maybe you know how it looks like. Look, girls, this is punch for biopsy. Wait a second, biopsy. Look, girls, for example, this is a punch of biopsy and the technique that they are just doing. Look, we are just putting screw with such kind of motion, then it's cut it, and as you can see, we are having already biopsy biopsy lesion. But what about the scalper? Scalper. Wait a second, scalper. Look. Mhm. Look, girls, this is scalper, this is head, and this is blades that should be changed after every use, and it's disposable, this one, but this one we can sterile, okay? This is handle that is sterilable, but the blade of the scalper always is it's disposable, so it should be changed. So during, as I already mentioned, when we are just taking biopsy lesion, it should include lesional and normal tissue. Why? Because of doctor should differentiate, for example, what is normal condition and what is, for example, abnormality. Also, that tissue that we will cut and we will just take from that part of the to the oral cavity or another part of body, it should have normal size. Okay, it should be large enough. So why? Because of to provide adequate information about that lesion. Also, I want to say about the several things about the punch. What kind, for example, advantages this instrument, that instrument punch is having during taking a biopsy. In this case, the incision, of course, is controlled. Also, approximately 4 up to 6 millimeters diameter of just the tissue we can take. Also, it's how should I say? It's less invasive. No, it's invasive, but you know it even after just taking biopsy with the help of the punch, mostly it's not reasonable, and if it's not necessary, not reasonable, it's not necessary to make it stitches. Okay, mostly. But when we are talking about and then when we are just taking biopsy with the help of the scalpel, mostly it just requires making suturing or stitches on that region, and of course it will be more how should I say, hard to do that. For example, girls, if we are just making and if we want to take biopsy from oral cavity, and for example this lesion we meet, for example, leukoplakia or something. Leukoplakia, by the way, this is such kind of condition, pre-malignant condition that reveals in oral cavity and mostly reveals in such patients who are just, for example, in taking tobacco or steroids, not tobacco or bad habits, such kind of, it's a smoker or just drinks excessive amount of alcohol and such things, appear such kind of white patches on oral mucosa, and this is pre-malignant condition. And if we want to detect and if we want to take this biopsy, always is better if we will take this biopsy lesion from, for example, buccal mucosa, then, for example, from gingiva and from tongue. And why? Because of this, for example, tongue in this case is a movable organ, and as soon as we will, for example, take biopsy lesion from that part, this means that it will be a little bit, it will create such kind of discomfort from following days. So for this reason, if we are having such kind of choice to take biopsy from buccal mucosa or from, for example, tongue or from gingiva, always preferable is to take from buccal mucosa. Another thing, just maybe just that I wanted to say about the biopsy is what? Of course, biopsy we are just doing under anesthesia, but I told you it depends on. Of course, we should be sure that representative of lesion is obtained. So of course, do not squeeze the forceps, as for example, this can cause crash artifacts. And we are placing the biopsy in small piece of paper before immersing in fixative, okay? And why? Because of this prevents curling. um, now just wait a second. I want to show you video, and then I have some photos to show you exactly how this biopsy lesion looks like when we are just taking with the help of the punch, and how just we are taking with the help of the scalpel. So wait a second. Now I'll share it. Look, girls, for example, this kind of okay, look now here. Oh, it's not voice.
There was a large lesion, you might soft tissue biopsies. Now by excisional, I mean we're removing the entire lesion.
We are just making, but when we are just doing with scalpel, as I already mentioned, mostly after this procedure, it requires making stitches on the region.
An incisional biopsy means you're removing part of the lesion. If there was a large lesion, you might not want to remove it all. In this case, we're removing the entire lesion, and there are two lesions which the preliminary diagnosis was fibroma on the patient's lip line, here and here, about where she bites, and these were bothering her. I knew they were not cancerous or malignant, but they bothered the patient, so I removed the entire lesion in both cases and sent them to a path lab to have them biopsied. You can see here's the lesion, so I'm going to take the entire lesion, so I'm making one cut on one side, and then I'll make another cut on the other side and join the cuts under the lesion. You want to go deep enough that you excise the entire lesion. Again, my preliminary diagnosis of both of these lesions was a fibroma. It bothered the patient enough that she wanted them removed. What you have to be concerned with when you're removing lesions in this area is that you will damage a salivary
This is stitching, girls, so suturing, how just they are making suturing of that region.
Gland and cause a mucocele. So you want to make the patient aware of that before you remove the lesion. And they bothered her so much that she was perfectly willing to take that chance, and it did not occur. I'm using gut suture so I won't have to remove the suture later. You could use Proline, and here's the other lesion. Again, I've preliminarily diagnosed it as a fibroma, and I'm cutting under the lesion and then over the lesion and joining the two cuts under the lesion to be sure to remove the entire lesion. This is just a 15 barred Parker blade. And I'm suturing that with 4-0 gut suture. Again, you may want to use proline, but if you do, you'll have to remove it. And if you do use proline, remember you've
Okay, girls, is it clear how this biopsy are just technique?
got to
How it
remove.
should be done.
Yes.
Wait a second. Now I'll show you something also. So look here, girls. As I already show you, this is with the help of the punch, just when they are just removing and taking biopsy lesion with the help of the punch. Look, such kind of lesion we are getting on, this is buccal mucosa, for example. But this is with the help of the scalpel. As you can see, this first on the first image, you can see that anesthesia is done locally. Then just they are trying to just hold that lesion that they want to remove. This is scalpel, how they are removing, and now this is it's cauterizing with silver nitrate also to stop bleeding, as it can say. What can we say about the oral smears for cytology? Cytological, yeah, even information will be important for us, but how are we just doing? Sometimes, if we can just take these smears with the help of the spatula, or even we can take with the help of the rubber. In this case, then it should be fixed on the surface of the that material that it will be rubber, or for example spatula, wooden spatula, or for example metal spatula, and then it's sent in laboratory to check that. What can we say about the lymph node biopsy? Of course, in this case, so we have to send it to surgeon, of course, and this biopsy should be checked if it's malignant or not. So that's why we are just doing lymph node biopsy. What about the labial salivary glands biopsy? Look, I have photo here. This is labial minor salivary gland. Well, we are talking about minor salivary gland. How should it removed? It's opening, as you can see, and we are just trying to cut the lesion, and then we are making stitches to get sure that what kind of problem patient is having, and other investigation or diagnostic methods. Just we are having many types of radiographic examination, cialography, this is for salivary glands, angiography for just blood vessels and their condition. Also, the next one is about the what is there? Arthrography also. We are having CT scanning also. Scanning also. We are having panoramic X-rays and such thing. Also, I won't pay attention because of we already talked about this. For example, in which cases are we doing salivary gland scintigraphy? In which cases are we just doing to detect if there is any kind of general disorder, as well as Sjogren's syndrome of salivary neoplasm, or for example salivary aplasia, and so on. Also, we have to talk about magnetic MRI. So it's the same as magnetic resonance imaging. So this MRI, just we are using if we want to detect any kind of problem on soft tissues. But what kind of advantages having? It's really a reliable method. It shows everything well and properly, but it's too much expensive. And also the second most great disadvantage that this method is having is what? It does not give us good image about the bone, okay? Just only the soft tissues. So we can just, for example, we can just find and identify any kind of these disorders that are happening on soft tissues. So girls, this was about the topics that I wanted to talk about, these investigation methods. So, are you having questions about that? Girls?
No, doctor, everything was clear.
So, now what about you? Did you prepare these indices for today?
Yes.
Okay. Who will start? Let's say like this way. Who will be the first?
Okay, I can start if you want, doctor.
Marilyn, your voice is not too much clear. Can you please, I don't know, increase your voice, or I don't know, we can't hear you well.
Right now, doctor, you can hear me? You can hear
What?
me right now? Right now, you can hear me?
I can't hear you at all, Marilyn. Marilyn.
Yeah, doctor, just I'm fixing it. 1 second.
Okay. So what about you, Reem, Sabrina, Ragat? Are you ready for today?
Yes, doctor. I'm ready.
Can you please, girls, all of you, switch on your camera, and at the same time I will ask you questions, huh? So, even I want to pay your attention about the second midterm exam, girls.
Yeah.
That topics that I sent, please read this information with exact pages with great attention, because I did tests around that pages. So, as I already informed, questions will be from that topics. Girls, also I want to pay your attention about that tooth mobility, how you should examine. Of course, there will be mentioned, so read this information, okay? So now, Marilyn, could you please explain us what is, for example, how you should PI index. Let's start from the beginning. PI index, what kind of index it is? Is it, for example, for periodontal disease? Is it for, if it's for caries? So please describe it.
Okay, so PI index. We are talking about, first of all, it was developed by Silnes and Loeb, and it's not about periodontal. The PI index, we are talking about the plaque that we need to measure it at the cervical margin of the tooth.
Okay.
At the cervical margin, which is the closest to the gum. Okay, and we have 4 areas. We have the distal, the facial, the brachial, the mesial, and the mesial and lingual. We have 4. Okay, and these surfaces we measure. We have 0 to 3. Okay, 0 it is.
But how many teeth are we detecting? You mentioned about surfaces. I'm interested in how many teeth, Marilyn, are we checking?
Yes. Okay, we check 60, 3 in the maxilla and 4 and 3 in the mandible. We choose 16, 12, 24, 36, 32, 44, for example. So
but also we can use 28 teeth also, all of them, but we can also use only 6 teeth, girls, in this case.
Yes.
Okay, just give me 1 second, Marilyn, please, because
What rain?
The electricity is went off. So I
Sure.
lost my connection. No, I'm
Sure.
saying I lost my connection.
Your connection. شكلي أنا مقطع.
أنا كيف؟
Okay, continue.
Just a second. Yeah. Okay, and these teeth, doctors, are evaluated according to their surfaces. And the scores are from 0 to 3. From 0, it is no plaque, it is good. And whereas if it was a score 1, it will be that the free gingival margin will have a film, a little plaque on the free gingival margin and the adjacent area of the tooth. Whereas if the score it is 2, will have like a moderate accumulation of soft deposit on the gingival pocket. And the 3, it will be that it is much more soft matter on the gingival pocket. Of course, it will be more than 2 and more than 1. And then in order to calculate the PI, we calculated the sum of all the teeth, the scores, divided by how many tooth that you have. That 6, we divided by 6. Right, doctor? And then we put like if it is 1.0 to 1.9, it is fair oral hygiene. If it's 2.0 to 3.0, it is poor oral hygiene. Okay? Hello?
Doctor?
راح.
Dr. Nana?
Doctor, you can hear us?
Sorry, I was talking and it was... So,
yeah.
There are many types of indices and concentrate on mostly on that indices that, for example, I explained and I talked with you, okay? These are, for example, plaque index, or for example, plaque control index, oral hygiene index, oral hygiene simplified index, also gingival bleeding, we mentioned PMA indexes, okay?
Okay, doctor, I have a question. Just a second. I was studying yesterday this course. You said when you sent the mail, you talked about maybe plaque index, but you didn't explain it on the lecture.
Maybe plaque index, I told you, we need not, because there are really many types of indices. So it's impossible to sit and just read about this, okay, from your side. So that's why I'm saying the most common indices that we are using nowadays is that indices that, for example, I'm saying these are plaque index, plaque control index, oral hygiene, and oral hygiene simplified. So gingival bleeding, PMA. Is it clear, girls?
Yes.
Okay,
Can I ask a question also about CPIT and Community Periodontal Index? Also, you put we have it in the book when you send the mail, but you didn't explain it. So we study it?
No.
Okay, no.
I
Okay,
didn't
dear.
concentrate it on. That's why we did not.
Okay.
What can you say about, for example, Reem? I want to ask you. What can we say about oral hygiene index? What do you know about oral hygiene index?
Yeah, so first of all, it was developed by John Green and Jack Birmingham, and it contains 2 elements, the Debris index and the calculus index. So the oral hygiene index is the combination of the Debris index and the calculus index. And for scoring, the dentist divides the teeth into segments, which means 6 segments, 3 in the maxilla and 3 in the mandible. For the maxilla, the segment 1, it's distal to the right canine, and the segment 2, it's from upper right canine to the upper left canine. The segment 3 is the segment distal to the left canine. As for the mandibular, segment 4 is the segment distal to the left canine, and the segment 5 is from the lower left canine to the lower right canine, and the segment 6 is distal to the right canine. So after we divide the teeth into sections, we select the facial and the lingual tooth surface in each section that is covered with the biggest amount of debris and calculus. So in this case, we have 12 surfaces to examine, and the index is based on 12 numerical determinations. So the method for scoring calculus is the same as for the debris, but additionally we make a record for subgingival deposit. And we have 4 different scores that are possible. For debris score, we have 0, which means no debris are present. 1, which means that the soft debris is covering not more than 1/3 of the tooth surface. And 2, which means that the soft deposits are covering more than 1/3, but not more than 2/3 of the exposed surface teeth. And 3, which means that the soft debris is covering more than 2/3 of the exposed tooth surface. So to calculate the debris index, the total debris score is divided by the number of segments scored. As for calculus score, it's the same, but we have to see the subgingival calculus also. So 0 means that there's no calculus. 1, which means that the supragingival calculus covering not more than 1/3. 2, which means the supragingival calculus covering more than 1/3, but not more than 2/3. And we have the presence of subgingival calculus around the cervical portion of the teeth. And for 3, which means that the supragingival calculus is covering more than 2/3 of the exposed tooth, and we have heavy bands of subgingival calculus that surround the cervical portion of the teeth. And finally, to calculate the calculus index, it's the total calculus score, which is divided by the number of segments scored. So the oral hygiene index, we calculate by a combination of debris index and calculus index. So the perfect score would be 0, and the worst score possible is 12.
12.
Yeah. So for the simplified, you want me to
Okay,
do the
Alexa
simplified
will
also?
say, wait. Alexa will say what's the difference between oral hygiene index and oral hygiene index simplified. We can't hear you.
Sorry. Okay, the difference, I think there are 3. So there's that the number of the tooth surfaces
Don't
it's
breathe,
called
Alexa, please.
is that we have 6 surfaces rather than 12. The method of selecting the tooth surfaces to be scored and the scores which can be obtained. These are the 3 differences.
Okay.
Yeah. So
how are we selecting, for example, teeth on during oral hygiene index? And what about how are we detecting on oral hygiene index simplified? How are we detecting and selecting teeth?
So we are selecting for posterior and to anterior. In the posterior teeth, we use the fully erupted tooth, distal to the second buccal teeth. Usually the first molar, but sometimes we use the second or third molar. In the anterior portion of the mouth, we use the upper central incisors or the lower and left central incisor. What else? Only the fully erupted teeth permanent teeth are scored. And the natural teeth with full crown restorations and surfaces reduced in height by caries or trauma are not scored. So, should I continue?
Yeah, please.
Yeah, we have, there are 6 surfaces that we need to examine. And that is the, as we said before, for posterior and to anterior. We use the upper 6 molars, 6, and that we see the buccal surfaces, or the lower molars, that again 6, the lingual surfaces, And lastly, it's the upper and lower central incisors that we see the labial surfaces. How we examine them? In order to obtain the scores for debris and calculus, we use the 6 surfaces in order to examine, as we said, the debris and the calculus. So, yeah. So what we use an explorer, and we insert the saliva injector into the patient's mouth. We select the teeth that we have to examine by choosing specifically 6 teeth, and then we evaluate them. And we start usually with the maxillary posterior sextant, and we work way around the maxillary arch.
What's the worst?
Then we go.
What's the worst
What?
score for possible? Just worst score for oral hygiene index.
12. A simplified 6.
No, 6. For
She said
simplified.
oral. Yeah, for simplified 6
okay.
for oral.
Yeah. 12, yeah.
So, yeah. What you said, sorry?
We said 12. And for
You said-
simplified, it's 6.
Yeah, oral is 6. I want to ask you, when we're just, for example, collecting information, and just when we're making for oral hygiene index, we are checking debris or calculus in this case. Which one are we checking?
2. Debris and
2.
calculus.
The debris and the calculus.
Both. So both
Yeah.
we are checking both. Okay, Sabrina, are you here?
Yeah, I'm here.
Are you ready for today?
I think so.
Okay. Could you please say things about gingival bleeding index? How are we calculating that?
Okay, so gingival index also is known as GI. It's based on the color, the consistency, and the bleeding and probing. Again, we examine 4 surfaces, the mesial, the lingual, the distal, and the buccal surfaces. So unwaxed dental floss is used for gingival bleeding, and there are 28 proximal areas that need to be examined. Unlike the oral hygiene and the simplified oral hygiene, you have to divide the mouth into 6 segments. So from the distal, so the first segment is from the distal to the right canine. I'm behind, yeah. So the upper right canine to the upper left canine, that's the second segment. And the third segment is the distal to the left canine. And again, that's the same with mandibular teeth. And so, yeah, after that, unwaxed dental floss.
Procedure. Can you describe procedure? How are you doing?
Yeah. Unwaxed dental floss is interproximal into the gingival sulcus on both sides of the interdental papilla. And then the floss is extended as far as possible towards the buccal and lingual sides, and even carried to the bottom of the sulcus. The floss is then moved in an inciso-gingival motion for a 1 double stroke. Okay, and from that you will get a bleeding score. So if there is no bleeding, so you just write none or blank. If there is bleeding, you put a B, and if if it's not scoreable, you put an X, and then you record that, and then the total areas you've scored, you minus from. This part I was confused about, actually.
Yeah, for sure.
This
I
part
want to ask
confused
you,
about.
Sabrina, what do you mean about non-scoreable area? Which region can be non-scoreable?
Sorry, can you repeat your question?
Which area can be non-scoreable? You mentioned it's when you just
Yeah, I mean, I wrote it down because I was listening to your lecture back from last Wednesday.
yeah, but what means non-scoreable area? Which region can be? Who can answer?
Yeah.
Diastema or space, or when you have stram or diastema or space. So when you have these, are
diastem.
not scoreable. Yeah.
Is it clear, Sabrina? So diastem, this is condition when we are having physiologically, of course, we are having gap between for central incisors, or trams we are discussing when we are having gaps physiologically from, but on posterior teeth region, this means that intradental gingiva does not feels embrasure between two adjacent tooths. If it's for you, it's hard to, for example, realize. I can show that photo and I think it will be more clear for you. Wait a second. I show them, but maybe it was not at the same time there. Wait a second. I'll share it and please check it carefully. Look, Sabrina, look here. As you can see, when we are having diastema, this is condition when we are having a gap between two adjacent teeth. As you can see, intradental gingiva, we are not having here, so it's not filled. But here, as you can see, if there is normal proximal contact, we are having intradental gingiva, and it's normal condition. Is it clear? So in these cases, when we are having diastema and trams, in this case, we are not checking that region. That's why that areas we are referring non-scoreable region. Clear, clear? Sabrina, we can hear you.
Sorry, I turned the mic off. Yeah, it's clear, it's clear.
Okay. So, wait. So, what about Reem? I want to ask you about the plaque control. How are just we doing? How are we? Which teeth are we selecting, and how are we calculating? Reem, we can't hear you. Reem.
Oh, sorry, doctor. Yeah.
Okay.
For the plaque control, first it detects the presence of plaque rather than it's not present. And first of all, we have to examine all the teeth. And missing teeth are indicated as a thick horizontal line. And four surfaces are examined: the facial, lingual, mesial, and distal. And the number of surfaces examined may be increased from 4 to 6. With the 6 surfaces, we detect the facial, mesiofacial, mesiolingual, distal, mesiolingual, and distolingual. And for the procedure, each tooth surface is examined for the plaque at the gingival margin, and recording is done. And we may use the disclosing agent for the patient, or we ask the patient to chew disclosing tablets, and then he rub the solution over the tooth surfaces with his tongue before rinsing. And for scoring, the number of surfaces with the plaque is multiplied by 100 and then divided by the number of tooth surfaces examined.
Okay. Girls, are you ready, for example, from previous to ask you questions, for example, from previous topics?
You can ask us. If we know, we know. If no, we don't. Because we didn't, to be honest, we didn't study. We had exams yesterday.
Having.
What, doctor?
Good attitude. Okay, let me check it.
Because we had exams, we are barely studying this material. That's why.
Okay, let me open books, and from book I will ask you questions. Okay, let me revise. Okay.
From which book?
Not you. It's not you. For you. On exam, you won't have girls books, so that's why without book, let's try to discuss it.
Yeah, but because we didn't revise yet, that's why.
Let's
We only did.
you remember, okay? Let's see what you
Yes.
remember. Could you please explain, for example, what is percussion? Let's start from Alexa. What is percussion, Alexa, and how are we applying percussion? And please describe that. It's intraoral or extraoral examination method.
Okay, percussion. Percussion.
Camera.
Yeah. Okay. So percussion, I think it's an intraoral examination. We usually use it as a feature for acute inflammation of periodontal ligament. We usually what we do gentle percussions at different angles in the teeth, just to check the inflammation that we have. Yeah, I think that's it.
Inflammation of what?
Of periodontal ligament.
Of periodontal ligament.
Mm-hmm.
Okay, when we are talking about on posterior teeth, how are you applying percussion?
The same way, maybe.
Huh?
What do you mean, how we do that?
Because of, I understand that you were clicking, you mentioned about this, but for on posterior teeth, Marilyn, how are we applying percussion?
Also with the probe at the back of the probe on the tooth.
Yeah, but always mention that we are checking each cusp. We are clicking each cusp because
yes.
It
Okay,
should be
okay.
checked.
On the occlusal surface, you mean?
What?
On the occlusal surface.
Yeah, for sure. On occlusal surface, we are checking. This gives us information about periapical status of periodontal ligament in this case, and of course we are just doing like this motion. But I could not, for Alexa, keep up with you. Did you mention about this procedure that you should start from healthy tooth? Clicking of the instrument, we should start from healthy tooth. For example, patient is mentioning and say that 1-4 tooth is painful, okay, during chewing or something. Always you should start
from
clicking from adjacent healthy tooth. And why?
To see the difference.
To
the
find
patient feel.
To differentiate what kind of discomfort patient is having when we are clicking on healthy tooth and what's happening when we are clicking on unhealthy tooth. Now, would you please, who can talk about palpation? And for example, how are we palpating lower submandibular salivary gland, for example?
You mean the one that we did?
I'm talking, listen. I'm talking about salivary gland and not lymph node. I'm talking
the parotid.
Mandibular salivary gland, not parotids. How are we palpating and what kind of palpation are we just referring that?
We use, I think, our We use our hands in order to palpate the
Yeah,
intraoral.
palpation means that we are using hands, so
Yeah.
it's logical. So what are we having to use in this case?
Uh,
So how?
second.
So what are we doing in this case? Bimanual palpation. Girls, we are having big gaps, so you should stop smiling and just pay more attention on your books. We are making bimanual palpation, and on during OSCE exam, I need the exact definitions, and exactly you should say how are you doing this procedure. Okay, as I already mentioned, as soon as you will do with your hands, of course, even at the same time you should retell, and you should say, oh, this is for example submental or sublingual, and how are you palpating that. During submandibular salivary gland palpation, we are using bimanual palpation. Okay, we are just doing bimanual palpation. What does it mean? Palpation, yeah, generally we understand and we know that, yeah, palpation is what we are using fingers and we are palpating on it with the lymph node or salivary gland. But bimanual means that one hand finger should be outside of oral cavity, and one finger, for example, index finger, we should place on the floor of the mouth inside. Okay, that's why, for this reason, that we are using two fingers during this time, during this palpation, we are referring bimanual palpation. Is it clear, girls?
Yes.
Please read this information. You are having exact pages, and read this information, how salivary glands should be palpated, how lymph nodes should be palpated. Okay, we will repeat also everything step by step, and if it will be necessity before OSCE exam, you will come, we will do one practice again. Okay, if it will be necessity.
Yes. Thank you.
What can we say, girls, about maybe lymph nodes and salivary glands? It's a little bit clear because of you want to understand, but please pay attention when you will read this information, pay attention how patients should, for example, to the hand, it will be in front or on that side. Okay, so please pay attention about that. Now just let me check it. What is here also discuss? Percussion, we discussed it. Yeah, and about periodontal evaluation. Girls, I told you that periodontal evaluation we won't discuss, and we will, for example, this topic add on final exam, but in that books that I sent and that pages that I gave you, there is written such kind of condition. How we should evaluate mobility of teeth. I told you we are having different classification, but please read information about it, which classification is discussed there. So please pay attention about that.
Okay.
So the next thing that I want to just, for example, talk about, I'm interested in how are we detecting caries? Could you please explain it to me? How are we detecting caries?
First of all, we can detect caries by using.
Remember, girls, I don't need your just reading from book and so. What you remember, what we talked during this time.
Okay, we can detect caries by using a probe. First.
Okay, what do we refer this procedure that we are using? Probe procedure.
It is visual tactile, right?
Huh?
Visual tactile.
No, this is, yeah, visual tactile, but second name is what? Exploration.
Exploration, okay.
Okay, then?
Okay, we can use the exploration method, or we can use the disclosing agent. We put the dyes on the tooth, and also we can use radiographic examination. We have also fluorescent
transluminescence.
Yes, a transluminant examination. What also we have? As I remember, I didn't study it yet. What we have also? Radiograph.
Yeah. That's a fluorescence and transluminescence. It's
yeah. So we concentrate on
example.
these 4 only, because in the book we have like 10, more than 10. We have 15 pages only how to detect caries, and so many explanations. We concentrate only on these.
Okay. Wait a second. So Sabrina, Marilyn, did you ask me something or?
Yeah, we have for the midterm 2 caries detection, but we have 15 pages. So we concentrate only on these 4 methods.
I gave you exact pages, so concentrate on that pages that I gave. Questions will be from that pages.
Okay.
Why?
Because 16 pages and many different examples.
Many different what?
Many different examination we have.
For example, what is different?
Yeah, wait,
It
let
is
me,
hard for you to remember.
just a second. Okay, just a second, doctor. We have electronic caries monitor. Like a
Electronic what?
3-page. Electronic caries monitor.
Then what?
Then we have subtraction radiology.
Many things. Even, yeah, and I remember that I even make the tests from that part, so pay attention.
Digital radiograph. We have many
No
types.
problem, you should know. It's your job. So, yeah, I remembered now that I made the tests from there also.
Photothermal radiometry, we have it?
Yeah.
Oh,
Pages that I gave you, concentrate on. So, is there any questions also around anything that you are interested in?
You want to give us some hints for the exam?
No.
Okay.
I don't think so.
Some hints.
No way. I'm never giving them. None of my students.
But is it easy or not?
If you know, everything is easy, girls.
Yeah.
When you know something, everything is.
That's the problem, that we need to know everything.
Huh?
That's the problem, that we need to know everything.
Yeah, for sure. This is exam.
Yeah. Doctor, for our Friday practical, what we have? We need to do indices.
Indices and caries detection. It will be better if patient who is having caries to sit on dental chair. I don't know, check your oral cavities.
Yeah.
Check your oral cavities with the help of the mirror. And if you think that you are having caries, you have to see, and just for example, I want to show you, girls, for me, it's not problem at all. I can do it on model. For me, working on model, it's more easy,
Yeah.
Because of some reasons, okay, for sure. But I want to show you. If you don't want, I saw and I'm seeing caries maybe 100 times a day. It's not my interest at all. But there should be someone to show you. Even this dental plaque, how to identify, how to calculate, you should be interested in. So it's not my interest. So in this case, at all.
Doctor, I don't care, so I'm not.
That's why Alex said directly we just removed with a process of elimination. Yeah.
No, I don't. You saw it, and also yesterday I went to Miss Sophia, and she told me I'm fine.
Great.
And I asked her about what you told us, like for how long. we should leave the instrument for sterilization after, like the sterilization.
Oh, yeah, this question I
And she
forgot to
told
mention.
me like it depends on the manufacturer. And when I told her like for a month, she told me sometimes it's too long, even a month.
Manufacturer? What do you mean about
Like the person that has created the procedure, it depends on the things that you are
It
working.
depends on the machine also.
Yeah.
I remember that from last year.
Yeah. Like last year, and that
manufacturer of machine, autoclave, you mean? Manufacturer
Yeah, the
of
autoclave. Yeah.
It depends on the material that you are using, she told me.
So what is your answer?
It depends on the manufacturer. This is what she told me.
Okay, try to find more. I can send book.
But she told me that 1 month is too long sometimes.
Wait a second. If you want, I can send you. Wait a second. If I have it, maybe it's you know in which book? Give me 1 second. That book that I sent. Just wait. I won't say. I want to try to find it.
Okay, doctor, how many classes you still have?
We still have, as I know, till 25. Yeah, am I right?
Yeah.
I mean, 25.
We are meeting. So we will left to 1 class next week, and we are finishing next week.
So this week and 1 more.
This week and next week. Yeah, we are finishing next week. Wait a second, girls. I'll send it to you if you want today. If I'll find it now, maybe. The sign hygiene norms is written. Yeah, that book. Look, Nisha Garj and Amit Garj. Infection control. Maybe it should be there. Maybe it is written there. I don't know. I should check it. No, it's the 104. Check it, okay? There. Infection control.
Okay.
Wait, yeah, for example, dry hits the autoclave. We need autoclave because I'm talking about autoclave. Nowadays we are using this one, that's why, okay?
Okay.
Not glass bead and such things, okay? I'm talking about autoclaving, but I'm interested in if it's written here. Wait, I picked a sterilization of instrument. Don't ask lecturer, you should try to find it.
Okay.
Check it, maybe it's not written here, but try to find somewhere. I did not remember from where I did this presentation for my students, that's why maybe it was in different book. Okay. So girls, is there any question?
No, doctor, thank you.
So not for me.
We'll meet on
Friday.
Friday. Yeah, and we will.
Doctor, it is at 2 o'clock as usual.
Yeah, at 2.
Okay.
Or at 2:30. Is it possible for you?
I think you said
or after my practical trainings. Are you?
I think you said to me a bit.
I didn't hear what you said.
What?
After 2:30. At 2:30 will be clear. It's just normal for you?
Yeah, no problem.
2:30. Okay, I will talk to Salome and she will text you.
Okay.
And Marilyn, for tomorrow, do you have a 12?
I don't know. I asked her. She didn't reply yet.
Because the last time we had a 12.
I told her if it is at 4. She didn't reply yet.
To whom? To Sopo.
No.
No, for cardiology.
Yeah.
All right, doctor. Thank you. See you on Friday.
Okay, bye.
Bye.
ليه ما كتبت تقول شيء؟
What?
Doctor, for the dental, for the caries indices.
For the what?
For the caries indices.
Indices, yeah.
Indices, yes. So they are saying that we should total the D, M, and F for each individual. What does it mean? So we have to total the D alone, M alone, and F alone?
I can understand your question. DMFT index we are having for caries detection. We are detecting D means decayed or diseased or denoted teeth. F means the field or already restorated teeth. M means missed or extracted tooth. Okay.
Yeah, I know that, but I'm confused. I'm confused when we should add the DMF all together and when we should adding all of them each alone. So D alone, M alone, and F alone. I'm confused in this.
Nothing. DEF and DMF, you mean for deciduous dentition?
For permanent dentition.
Not just nothing. You want to detect it and you are just collecting information about that. You are not adding
but they are saying the average GMF is total GMF. It's divided by the total number of individuals examined. So total DMF, we calculate the D and MF. We're adding them all together.
Yeah, you know, how are you doing? For example, we are having one oral cavity, okay? We are checking the MFT index. For example, after checking oral cavity, we are having 4 teeth with caries, okay? I'm writing down 4 plus then missed teeth. For example, I'm having 2 teeth. I'll just wait a second. I'll write down in chat and I think it will be more clear for you. So, girls, look at this here. When I'm just talking T, the last T means tooth. So don't pay attention about this T. D means decayed. So when after checking the T's, I found that 4 T's are decayed. M means missed, or this means that 3 T's are missed or extracted. And F means that 1 teeth, look in oral cavity, I found that it was filled with restoration. I mean this.
Yeah,
And
so
doesn't have anything.
average, we add the 4
No, we are not
8.
counting, and no, after that we are not continuing anything, okay? Just we are having this result. We are not, for example, collecting these numbers, okay? Just we are writing down these numbers, and these numbers means that we are having, for example, these problems, okay?
Okay.
Am I answered your question, Reem?
Yeah, thank you.
Okay.
Okay, doctor. Thank you. See you on Friday.
You said that we don't need the navy plug index, right?
No.
Okay. So it's the only index that we don't need.
Yes.
Yeah. I told you already which indices we needed. It's the beginning of the lecture.
Okay, doctor. Madluba. Bye.
Okay, bye.
Thank you. Bye.